And good evening, everybody, and welcome to our latest Welfare Wednesday webinar series. For those of you who are used to this, we're just going to hold a bit of time while we wait for Facebook to join. So we've got our Zoom viewers with us, so thank you very much for joining us on Zoom. And as I say, Facebook always just takes a little bit more time to come through. But we are now connected to Facebook. So once again, everybody, welcome to our current episode of Welfare Wednesday webinars, where we're going to be talking about all things dentistry. So we're always very pleased to see so many of you attend these webinars live. And one of the really easy ways that you can continue to support World Horse Welfare and ultimately horse welfare in many ways is by encouraging your friends and family to also attend to watch these webinars. We have some really, really great speakers that attend and talk on behalf of the horse. So yeah, spread the word and encourage as many of your friends to join in. Anyone can register to join us on Zoom for free, which we feel is the best way to participate, as you can also take part in our poll questions as well. But you can watch it live on Facebook, which I know many of you are tonight. You can also subscribe to our YouTube channel, which and watch back at a later date. And I think hopefully the link should be now in the chat function. So as I say, subscribe to our YouTube channel. So I'm just going to quickly get my screen shared. So, as I say, tonight we're going to be talking about all things equine dentistry. And we're really pleased to welcome equine vet and dental specialist Stuart Altoft, who actually also is not only a great vet and dentist, he also treats our horses at our Glenda Spooner Rescue and Rehabilitation Centre in Somerset. And is a British Association of Equine Dental Technicians chairman. Oh, sorry, and we're also going to be welcoming James Arkley, who is the our British Association of Equine Dental Technician Chairman as well. So just to repeat that we want you guys to continue to be involved, and this is a real two-way conversation. We're going to hear from Stuart a little bit first, and then after that it's going to be our Q&A session. So for those of you on Zoom, please use the Q&A tab to put your questions into there. And anybody on Facebook, you can put any comments or questions into the comment section there and share your views. If you, as I say, if you enjoyed today's discussion, please do attend our other ones and get your friends to come along too. And as always, we always welcome ideas for future topics for these webinars as well. So you can let us know in the chat on either Zoom or Facebook or an email at education@worldhorsewelfare.org. So I'm going to ask a quick poll question just to get everybody thinking and a bit involved. So for those of you on Facebook, our poll is, who performs your horse's routine dental care? And the options provided are your vet, your BAEDT accredited EDT, other accredited EDT, other, or I'm not sure who performs my horse's routine dental care. So while you guys are thinking about that question, I'm going to very quickly introduce our first speaker, who is, as I say, veterinarian Stuart Altoft. Stuart graduated from the RVC in London and has a particular interest in equine dentistry, passing the BIVA and BVDA equine dental technician examination in 2010. In 2015, he was awarded the RVC Certificate of Advanced Veterinary Practice in Equine Dentistry and is one of a very small number of RCVSs to have that accreditation. In 2017, Stuart founded the practice Some of These Vets with Jenny Clayton. And when asked about Stuart's, an interesting fact about Stuart, he and I'm going to use his words because I'm not being rude, but he said he used to play rugby, but he's a bit old now. However, he still keeps his hand in a little bit at it by coaching his son's rugby team at the weekends. So if I'm going to stop sharing my screen a second, and I'm going to ask to see if we can see some of these poll results come in. So, oh, it's quite a nice split. I hope, Stuart, you can see that. So we've got sort of 48% are saying the vet does it, 45% are saying a BAEDT accredited EDT does it, 6% would be an other accredited EDT, and 0 with other and 0 with I'm not sure. So that's nice to see that for our audience today that most of them are using they're all using it. So I will on that thing, pass over to Stuart.
Right. Thank you for thank you for the introduction. So as Alana said, my name is Stuart Altoft. I am a vet and an advanced practitioner in equine dentistry, and I run the dental referral service at Somerset Equine Vets in Devon, seeing routine cases, but also advanced referral cases from other vets and EDTs. And hopefully this is going to work. I will try to get the presentation up. Hopefully you can all see that. So my brief for this presentation was all of equine dentistry, which is a fairly challenging thing to do in a relatively short amount of time. So I will apologise if we whistled through this a bit. Horse dentistry has advanced hugely over the last sort of 20 years since I've been in practice, and more techniques are coming into play, either directly being developed for horse dentistry or evolving from human dental techniques. But there is quite a big difference, and the most common treatment that we perform on horses' teeth is removing sharp points and overgrowths, which is something obviously that bears no relationship to any dental treatment being done in humans or dogs or cats for that matter. Which leads to the obvious question of why, and the important thing is that horses are different. Around 50 million years ago, horses evolved from small sort of fox-sized creatures living in the forest to animals who could graze the increasing areas of grasslands that were developing. But grass, although it looks nice and soft, is full of abrasive silicates. And if we were to try to, aside from the fact that we can't digest it, but if we were to try to live on grass, we would very quickly wear our teeth down to smooth, non-functional nubs. Horses deal with this by developing they've evolved what we call a hypsodont, or long tooth system, compared to the human tooth, which is a short crown with longish roots. A horse has a very, very long crown with roots at the bottom, and as their teeth are ground down by grazing and by constant chewing, they wear that tooth away, and new tooth erupts. This is different to animals like rodents that are constantly producing tooth. Horses have a finite amount of tooth that slowly comes out and gets worn away. This matters from our point of view as horse owners and vets and EDTs, because the lower jaw of the horse is narrower than the upper. So as the horse chews, there is a mismatch in where the teeth actually grind. This is exacerbated if if their jaw alignment isn't perfect, or if they're fed on a lot of soft feed and they're not having to use the whole width of the tooth to grind. And so what that means is the areas of teeth that don't come into wear will develop little enamel overgrowths, which can be really quite sharp. If these are really nasty, you can see these little enamel overgrowths on the edge there. If these are really nasty, then it can cause issues with eating or general comfort. But as riders, sorry, this is Bob, who will come in quite a bit into the presentation, and you only have to look at where tack sits for it to be really obvious. If we've got little sharp edges on the outside, particularly the upper teeth, or little hooks, little sharp points on the front of the teeth where the bit sits, it's fairly obvious why that might cause discomfort or start to cause us ridden or performance issues. They don't have to be particularly bad. They don't have to be particularly large to cause ulceration. This photograph, those edges are just a few millimeters, but they're sharp enough to be starting to dig um, into the sides of the cheeks. If a horse has missing teeth or misaligned teeth, these overgrowths will be exacerbated, and particularly if they're not dealt with, you can develop these very, very large overgrowths. In this particular case, these were impacting on the soft tissue opposite and causing this horse quite a lot of pain eating. So it's not just about ridden comfort. It can also be about simply their ability to eat. Many of you, if you have horses, will be familiar with floating or rasping. We predominantly use powered rasps at my practice with a fine diamond blade, which are well tolerated by horses and really gentle to the soft tissues in the mouth. It's really important that we get far enough back in the mouth and that all the teeth are treated. It's not uncommon for me when we're examining horses to find that the very back teeth hadn't been rasped thoroughly. And if you think back to the skull with the tack on, you can see those very back teeth are right on the inside of that very large muscle that you can see on the outside of a horse's head. And are really going to be impacted. There's not a lot of space in there. So if you've got sharp points, that's often the worst place that they're going to be. Sometimes very large overgrowths need to be taken down in stages. Oh, sorry, I skipped on too far. And that's the horse from earlier with the very large overgrowths. And because this tooth is live, I've been able to take it back as far as I safely can without entering the live part of the tooth. But now we're going to have to stop, and then we'll come back to that in a few months just to continue taking that down until we can get him exactly as we want him to be. The next dental issue, which a lot of owners will be familiar with, are wolf teeth. These are technically the first premolar of the first premolar tooth that never went through that evolutionary process to turn into the very large cheek teeth that we're all familiar with. They're often small, but their position just in front of that first cheek teeth means they can be caught by the bit and cause discomfort during ridden exercise. Traditionally, they would be removed. Not every wolf tooth needs extracting, in my opinion. Some are tucked in just on the inside of those upper cheek teeth. But others are large or displaced forward into the bars of the mouth, or they haven't erupted properly and they sit just underneath the gum. And these are very likely to cause us problems, particularly with ridden work, and should be removed. Equally, the much rarer lower wolf teeth always seem to cause issues in my experience and are worth taking out. Extraction isn't always completely straightforward, but it usually isn't associated with any great complications. And it's always, again, in my opinion, it should always be done under sedation with local anaesthetic. I think the days of taking these out without should have been and gone. Hopefully, none of us would really want to have a tooth taken out without nerve blocks, and I think we owe it to our horses to think about them the same way. Probably the next most common problem that we see as practitioners looking in horses' mouths are diastema, which are spaces between the teeth. Horses' teeth are designed to sit like a row of bricks very tightly together and almost act like a single functional unit. Spaces between the teeth can occur for a number of reasons, and they can cause food to become trapped. You can probably just see some food sort of just sticking out the side there in this picture. That food then festers and it can cause gum infections, and the gum then recesses, and this seems to be an extremely painful condition. It will definitely cause us performance issues in a lot of horses, so head tossing, difficulty on the bit, or just not seeming comfortable. And in some horses will cause quidding or dropping of sort of half chewed forage material. As the horse chews, that food gets back to the painful part, and they don't really have any other way of dealing with it. So they simply sort of spit it forwards, and it comes out again. Um, they can be dealt with in a number of ways. Some horses respond really nicely just to having their teeth balanced really well. Stop taking away any overgrowth, so they're encouraging feed to pack in there. But with others, we need to go a little bit further, either widening that space so that the food doesn't become trapped, or in the picture on the right, you can see that space has been widened, and then right at the bottom of it, there's a little bridge that's been put in there just to keep the food away from the gum line and give it all a chance to heal. Fractured or infected teeth. Many of you will have come across horses that have had tooth root abscesses or fractured teeth in the past. If infection gets into the root of the tooth, it can cause swelling of the jaw, which will sometimes burst out. But the four cheek teeth in the upper jaw at the back, their tooth roots enter the sinus of the horse. So infection there can give us a one-sided, usually really foul smelling nasal discharge. Sometimes improves with antibiotics, but always comes back again. And that's a real clue that that's something else causing the problem. And an awful lot of the time, that's going to be an infected tooth. And unfortunately, that sinusitis will only resolve when that tooth's out. And you can see on this X-ray, whether you can see my mouse pointer or not, but on the X-ray we've got the tooth's right in the middle, which has got the roots have become blunted, and there's an area of sort of black around the bottom of it, and that's a sure sign of infection. Infected incisors, so the front teeth, are a slightly different story. Hopefully the color on this is good enough for you to be able to see that there's the tooth at the front, just on the right hand side of the center, has a grayish appearance to it. Don't worry too much about those black spots on the left hand tooth. That's just a bit of enamel staining, but that gray appearance is a real indication that that tooth is dead. Unfortunately, these teeth had been there for a little while, and so had an infection, had burst out at the roots, and we had quite a lot of blunting and enlargement of the roots. So, unfortunately, that one needed to be taken out, and this is the end result. If we get to these earlier, and this is a similar presentation, but had no X-ray changes, had no changes to the root of the tooth, they can do really, really nicely with root canal treatment. So where life becomes slightly tricky is that the incisor tooth in a horse is a curved tooth, and so we can't, like a human, you can't start at the top of the crown. We have to effectively drill a hole as high up as we can get, which allows us a straight access to the root, which is what you've got in the right-hand picture. That's root canal is then being completely cleaned out and is packed in stages before being completely filled in, and then the crown is filled in as well. And this is what it looks like on X-ray. So all the way back to the base of the pulp. And that tooth should then now be that should now be a permanent solution to that problem. And the advantage, of course, is that horse has has been left with the tooth, and also it has a much shorter recovery period than a tooth extraction. Horses tend to do really well with one or even a couple of teeth removed, but as with humans, if we can keep the tooth there and keep it functional, then that's obviously a better solution. Horses have in their upper teeth, they have a central enamel cavity, which we think is there to increase the amount of enamel within the teeth and increase the grinding surface. And that central cavity should be filled in with a substance called cementum, but sometimes that infilling isn't perfect. And if that happens, that cavity can then become packed with food, which decays. It's effectively a very small, blunt-ended cavity. So there's no way for that food to come out by itself. It can cause infection of the tooth if it breaks out of that enamel. You can see on the picture on the right that sort of that black material in the center of there. It looks like it's just starting to eat away at the sort of white enamel around the edge of it. The other problem it can cause is it can weaken the center of the tooth and cause a fracture, and those teeth inevitably then need removing. If we can get to these cavities before they progress as far as that, then, sorry, obviously these are the fractures. If we can get to them before they progress to that, we can clean them out. This again is done in a standing horse, just under sedation. This isn't a live part of the tooth, so it's not a painful procedure, but it is fiddly and needs to be done under endoscopic or dental camera guidance. And once it's clean and sterilized, they can have a filling put in there, and that filling wears down as the tooth grinds down, so it stabilizes the tooth and should be there permanently. The last dental condition, which I thought was worth touching on, is something that we refer to generally as EOTRH. It stands for equine odontoclastic tooth reabsorption and hypercementosis, which is why we have it's generally referred to as by its letters rather than the full name. It's an odd condition which generally only affects older horses, where the body starts to attack the tooth roots, or in the horse's case, it's actually the reserve, that long crown that's still within the gum that gets attacked. There is a similar condition in humans, one in cats, and certainly in humans and cats, it seems to be extremely painful. And I think we would say the same thing with horses. The teeth can become loose. They can develop discharging tracts, which will produce tiny little bits of blood or serum. And if you look closely at the picture on the left-hand side, you can see there's little pink dots just above the teeth, and that's one of those discharging tracts. And it's so painful that often horses can't bite down with their front teeth. And there are lots of videos on the internet of what's generally referred to as the carrot test, which literally holding onto a carrot and asking your horse to try to bite it off with its front teeth. And if you can't do that, that's an indication that those front teeth may be uncomfortable. It's not 100%, because some horses just don't like to do it, but it's particularly if they've always done it before and now they can't. That's a hint. Unfortunately, there is no treatment for this in horses or in humans, other than removing the affected teeth. So these are some X-rays which of the case we've just been looking at, which show very nicely these areas of just black where the tooth is just being reabsorbed. Sometimes, which appears to be happening slightly in some of these teeth on the left-hand side, the body tries to reverse what's going on, and the only substance it's got, the only live part of the teeth that's still able to produce more of, is cementum again, and it will lay down layer and layer of cementum on the outside of the tooth to try and protect it. It doesn't work, and so what you tend to find with a lot of biological systems is that if they've only got one option and it doesn't work, they just try to do it again and again. And so sometimes we can end up with these very, very enlarged tooth roots with a big bulbous projection on the end of them, which again just adds to the discomfort. As we said, the only treatment is extracting the painful teeth, and sometimes as in this case, that can be all the front teeth in the front arcades. It sounds like an odd thing to say, but horses do really, really well after that. They can even go back to grazing, and they seem to cope remarkably well with it. And obviously, we've taken away the pain. Very last condition I wanted to touch on, which isn't directly dental related, is the joint of the jaw, the temporomandibular joint. The joint of the jaw is like any other joint. It can be affected with arthritis. There is a little cartilaginous disc in the center of that can become damaged or prolapsed. And if it's severe, it can result in difficulty eating, but more often this is associated with poor performance and difficult behavior during ridden work. Most horses who show mouth issues during ridden exercise will have dental issues. So always think teeth first and get that checked. But if that all looks okay, then the TMJ has got to be on the list. Sometimes we'll see horses like this where there's a very obvious disparity between the upper and the lower jaw if they have temporomandibular joint pain. But sometimes horses, just like humans, are not completely symmetrical. So their jaw doesn't, sometimes their jaw just doesn't sit quite straight. That has implications for what's going on with their teeth, but it may not be an indication of TMJ pain. It is possible for us to image it. We can take X-rays. It's not a joint that lends itself particularly well to X-rays because if you think about a skull, we've got a temporomandibular joint on both sides and a lot of complex bony structures in between. And so taking a side-on view gives us a very complex X-ray, which is quite difficult to interpret, particularly subtle signs. But we can take these so-called skyline views, looking at it up from an angle, just skirting along the edge of the joint. The one on the right has a very obvious bony abnormality. The one on the left, you might just be able to pick out, if you've got a very bright screen, some little bony overgrowths just running down the top edge of the bone just as it comes into the joint. And both of these are effectively, well, sorry, the one on the left is an arthritis case. The one on the right we think was a traumatic fracture, but it was relatively old by the time we got to see that horse. It is a joint that lends itself very nicely to ultrasound scanning, and the beauty of that is that we can see the bone surfaces, but we can also see this fibrocartilaginous disc in the center of that. And this is a horse that was in recently to actually have its teeth looked at, but in the process, we looked at its temporomandibular joint and diagnosed some arthritic change and some changes within the disc. The ultrasound scans are one of those things that become easier to look at the more you do. But if you look at the sort of white edge on the coming in from the right hand side, you can see there's an irregular bulge coming out of it, and that's new bone that shouldn't be there, and is a telltale sign of some arthritis. This one is really showing an abnormality within the disc. So that little triangle that hopefully you can see there's an odd, almost circular, quite bright white dot in the center of that, and that's a little bit of calcification within the disc, which again is an indication that we've got some inflammation going on there. Just briefly, signs of dental disease. So these are some of the ones that we often see. So dropping food. Some horses are just messy and will throw their hard feed around. But again, if this is a change, then it's certainly worth looking in their mouth. Quitting is almost always a sign of dental pain. So these are lumps of half chewed sort of hay or haylage that's been taken in, half chewed, and then spat out because it's hit something painful. Difficulty during ridden work, obviously, that is a can of worms, and there can be an awful lot of things that can cause those kind of problems, ranging from neck pain, back pain, lameness, almost too many to mention. But a good thorough dental exam has got to be part of that investigation. Sometimes you'll actually get a smell, or you'll get a discharge either from the mouth or the nose. And in extreme cases, we'll see weight loss or difficulty eating. But it's worth mentioning that horses have such high pain tolerances that sometimes even very severe dental issues don't always result in outward symptoms, which is another really important reason to have your horse examined, even if they don't require treatment, but examined on a regular basis. A lot of people will be familiar with the tools that we use. These are the sort of standard basic rasps that I use, and the metal gag. Although I would argue that these days probably our more important piece of kit is a powerful head torch, or some form of illumination, and a mirror. Even these are being not completely replaced, not on a day-to-day basis, but for the cases that we're concerned about, we think may have subtle changes, by the dental scopes and cameras, which are responsible for all the pictures that we were looking at today. And like this. How often should your horse's teeth be checked? It depends a little bit on circumstances. And my opinion is that every horse should be examined at least annually. But I think young horses, obviously not quite as young as this foal, although we do tend to include dental exam in our newborn foal check, because abnormalities that could be corrected if caught early on are really important. But certainly horses that are in large amounts of work, or young horses up to the age of about 10, who have slightly less dense teeth, which grind faster, should probably be checked every 6 months. And I would say older horses as well, it becomes much more common for them to start to develop dental pathology and issues, which if we can catch it, we can catch those things before they start to cause the horse difficulty eating, and before they lose any weight or any capacity. That's obviously a useful thing to do. Horses in the wild, without any interference in breeding them away from their natural conformation, and we're not asking them to do anything, we're not putting tack on or anything like that. Often their mouths are better balanced. They also graze, generally speaking, on much rougher material, requiring more chewing, so they tend to grind up their teeth. That said, horses that do have wild horses, we know, do have dental issues, and we know from studies that have been done looking at causes of death in wild horses in America, that dental issues do come up and probably are at least in part, responsible for causing mortality. And that is the end of that. So just a few thank yous, obviously, the World Horse Welfare for inviting me to give this talk. All the staff at Summerlees Vets who've been helping me madly run rounds, take photos, and help me on a day-to-day basis with dental cases. Staff at Glenda Spooner Farm for putting up with me on a weekly basis, looking after their horses. All the clients are brilliant at giving us permission to use photos, to take photos, and James and the BAEDT for supporting the webinar and taking part in the Q&A, which is about to start any minute.
Thank you very much, Stuart. That was really, really fascinating. Definitely had us all glued there. I'm going to quickly introduce James, and then as you've just said, Stuart, we're then going to be going into a Q&A. So let me just quickly bring up James's introductory slide. Welcome, James, and thank you very much for agreeing to accompany Stuart on our dental webinar. So James, and as with all things horse related, it's acronym central here, isn't it? Especially in the dentistry world. So, but James is a British Equine Veterinary Association and a British Veterinary Dental Association qualified equine dental technician, and I'm sure James will mention a bit more about these names later on. And he's a member of the British Association and chairman, sorry, of the British Association of Equine Dental Technicians. He has over 25 years experience of owning and working with horses, previous experience of backing young horses, racing, competing, teaching, being an ex-military household cavalry mounted regiment and BHSAI instructor. When we asked James about a quirky story or a quirky fact about him, he provided us with a good one. So James once had a private audience with the late Queen Elizabeth after backing and riding away one of her horses, and in return he was gifted an antique measuring cane. And I'm presuming you still have this, James.
Of course, it's a treasured
I
possession.
can imagine. I can imagine.
I've never proved that it came from the Queen, though, but it is a possession.
So as I say, I've got a few questions to get the ball rolling. And I can see that we've already got some questions on our Zoom Q&A tab as well. But yep, anybody listening, if you have questions, now's the time to get them in. We've got Stuart and James for another hour-ish of our time, just under an hour. Anybody on Zoom, if you want to upvote the questions you most want to see hear James and Stuart answering, that would be great as well. So I know we're a bit short in time, so let's get going. So James, once again, thank you. I know we've obviously just heard Stuart speak to us then, but what are some of the main differences between what an equine dental technician is allowed to do and what a vet can do with regard to the dental work?
On a day-to-day basis and routine dentistry, they're very similar. For me, and there is quite clear lines. When you look at this sort of different categories, what we are and allowed to do, there is guidance on that online from Beaver. But mainly any advanced work, so major extraction work, fillings, periodontal sort of problems. Extractions is where the biggest sort of fall comes in for myself. Whether you find things that are defected or loose, you can that's a time to be engaging with your vet. Any sort of dental caries, reconstruction work. So all your advanced stuff that sort of Stuart talked about is times that your average EDT can move that towards an advanced practitioner like Stuart or somebody in your area that does the same sort of thing. So massive large overgrowth, things that require sedation. Obviously, it's a good time to engage with your vet, whether that's to engage just for the sedation side of things or advice or to carry out that advanced procedure. So that's the main areas for the average EDT worker on a day-to-day basis. When they find these advanced procedures that need to take place, they need to have somebody in their remit like Stuart who you can pass on that information to and they can deal with it. A lot of the cases I deal with, if you're not 100% sure, what vets allow you to do is have that much more depth of ability to look into a problem with an x-ray machine or a scanner or scope, so they can get more information. And often you find that the more information helps you make better decisions about that horse's welfare. So for me, on a day-to-day basis, is engaging with the vets, usually to find more information about what's going on, and then you can make better decisions what to do with that animal. That's how it works for me.
And so I can imagine you obviously have a very sort of close, like in your area, you'll know your vets quite well then and be able to sort of get them on side if need be.
Yeah, we're super lucky. I'm super lucky in my area. We have 4 or 5 really big practices that I deal with almost on a weekly basis. Some more than others. Some have got some more advanced dental procedure sort of ability than others. So sometimes, depending on what I'm finding and what I need to know, depending on where I'd advise that client to probably take it best. Usually we go through the first opinion vets first, and then we can advise them from there to where to take it. So yeah, it's we're very, very lucky. We have this good relationship with all our vets around us.
And Stuart, you're obviously in a slightly different part of the world from James. Do you have a similar relationship with EDTs in your area?
We do, yeah, absolutely. I'm always keen for any cases to involve the primary vet, but in most cases, I think obviously what James was saying with regard to EDTs is not dissimilar to your to most vets on the road, in that there's a degree of training and kit required before you can start doing particularly things like cheek teeth extractions and restorations and those kind of things. And so you won't find, although technically speaking, the vets are qualified to do those things. You won't find people starting to do it unless they've got the relevant experience. So I speak to other vets and EDTs almost on a daily basis about cases, some that come in for treatment and others that we're just able to advise and let the primary vet or the EDT carry on with treatment.
That sounds like a very sort of sort of holistic way to be working as well, isn't it? And so James, we've obviously seen from Stuart a few very interesting cases. What would you say would be one of the strangest cases that you've been involved in?
Usually I find strangest cases usually belong to miniatures or donkeys. Miniatures are the lovely Shetlands, should I say, are usually quite difficult to treat. And tend to get pushed to the bottom of the pile a lot of the time. In big competition yards, they might have a small pony or a Shetland as a companion, and they don't always get the care they always need. And that's not because they don't want it, just purely because the competition horses sometimes take priority over that. So often if we find something, it's usually with a miniature, and it's usually involving some displaced teeth or overgrown teeth that have caused some serious problems. And you usually find these, sadly, at quite a late stage when the horse is having problems that Stuart's already mentioned about quidding or not eating very well, or saliva dribbling quite a lot. And then when you get to deal with it, it's usually becomes an advanced case, which is a shame. But usually a miniature and a large overgrowth is involved at some point, is what I would say.
And Stuart, you obviously must support other vets as well with your sort of obviously expertise in dental. What would you say would be the strangest case that you've come across or been passed
Actually,
over?
I mean, the strangest case is probably one of mine, and although it's something I'd learned about, this is the first time I've seen it. Am I able to share my screen again?
Yeah, go for it.
So hopefully that's up. So this is actually a young pony at Glenda Spooner Farm, so at the World Horse Welfare, who developed a swelling on the side of her head by her right ear, and we put the ultrasound scanner on because it felt like it was a sort of cystic structure, and I had this very abnormal picture underneath. So we took some X-rays, and the best one is the one on the right, which you can just about sort of see the skull, and then there's this very irregular thing on the just on the side there, on the left-hand side of the right picture, which if you've looked at a fair few X-ray pictures of heads, looks exactly like a tooth. And this is Ollie Crow from Bourton Vale Equine Hospital, who came and very kindly, he's a specialist surgeon. And so just as we were talking about people having areas of expertise, although I will do basic surgery, this is beyond me. And so we called in an expert, and Ollie very kindly came down and under general anaesthetic removed this, which is effectively dental tissue. This is this pony trying to produce an extra tooth, and it's something called a dentigerous cyst. They do exist in humans, and although I learned about them as a vet student, this is the first time I'd ever seen one, and this was last year. So that was quite exciting. The other thing that James was talking about, almost invariably in miniatures, and Welsh Section A's seem to be overpopulated as well in terms of odd teeth things. This is a tooth that's turned 90 degrees on itself. So the whole structure is just, for whatever reason, is turned completely on its side. And this is one with an extra tooth sort of tacked on the side of it. This is a miniature Shetland. So the two teeth on the right hand side are effectively in the normal place, and then we've got this extra one sitting on the left there. So we do see some weird and wonderful things sometimes, particularly those extra teeth are always a bit of a challenge to know, almost to know where to start and what's normal.
And with those extra teeth, is that like a genetic thing? Would it been born with that, and
It
would
will
it
have
have
been
run through
it will have been born with it to a certain extent, and then obviously the teeth are very much like people. The adult teeth come through over time as you grow up, but presumably the sort of dental bud to start that tooth they'll have been born with that, and then it just works its way through. And often they don't become apparent until the biggest problem they cause, because they're abnormal, they either overgrow because they're not in wear, or they just pack food around them because they don't have that nice neat connection between them, and you just end up with this horrible foul smell coming from the mouth.
And I think you actually touched on this a bit in your presentation, but what age should a horse be when it sort of first has its first dental treatment? And should we be introducing them to any of the equipment at a slightly younger age, or what would be your suggestion if we have young horses?
Well, I'm definitely gonna be interested in James's opinion on this as well. My thought, it depends a little bit on what the plan with the horse is. I mean, as I said, we look at them as foals if we can, just to make sure that everything's okay. And then as long as they're not having any problems, usually around sort of between 2 and 3, certainly before there's any thought about putting a bit in their mouth, or them doing any sort of significant amount of sort of handling, would be my thinking. It's always surprising how people think, oh, I'm not gonna back them until they're 4, so I'll get their teeth looked at just before that. But actually, they've spent the year before with a bit in, getting them used to all of that. Actually, potentially just teaching them that this thing is associated with mouth pain, if they've got sharp edges or if they've got loose wolf teeth, and so. Yeah, whatever age you're thinking about starting them, get their teeth looked at just before then. I don't know what James's thoughts are.
I mirror your thoughts. My own practice, we have 2 is a good guideline. We like to see the horses before any sort of dental changes have taken place, before any bitting takes place, and then we can rule out any sort of simple problems like wolf teeth when they've got plenty of time to recover before any bitting takes place. And and anything like dental changes, retained caps, we can deal with them quietly. And in that period of time, when I shouldn't say it, but when I say where dental balance isn't very important, it's an easy early stage when the teeth are changing, and you're going to find a lot of imbalance that time. But during that process, you can introduce the kit nice and slowly, so the horse can get used to the gag, get used to the sounds, get used to the lights, and you can slowly chip away at very simple procedures. And by the time the horse gets to what I call a full mouth at around 4, 4.5, you then already got the horse used to routine dentistry, and the horse is away and going. So you've already, any minor problems have been taken out of the equation early. So 2 years old is a great time.
That makes perfect sense, definitely. And obviously probably keeping yourself safe as well, it must be a big challenge. So I suppose the younger that you can get them used to that equipment, does that make things obviously hopefully a bit easier for you both?
From my perspective, I say 2 as a guideline, and a lot of that time it's only affected by whether the horse is ready to be accepting of that at the time. You find some of the studs or racehorse yards I go to, their idea of an easy to handle horse wouldn't always be my idea. So if the horse is ready to accept it and the horse is at the right age, then we can start working with it. But yeah, the horse has got to be prepared in some way. It's got to be easy to be haltered and reasonably placid to deal with. Otherwise, you're starting off on the wrong foot.
And my final question before we jump on to our Q&A, which I can see is filling up nicely, is I'll start with you, James, on this one. It would be what would you say is probably the most common dental issue that you see, and is there anything that we as owners can be doing to minimize its prevalence, whatever this issue is?
The way of what I think I see is I see sharpness every day, and that's a real simple thing to correct. Simple imbalance or ETRs or overgrowths are things that can be easily rectified and can be quite destructive long term if left. So I think things like routine dentistry, vitally important, making sure our horses are fed as natural as possible. Soft compound foods don't really help. They can be quite sticky and don't help in the process of carious lesions later on in life. But so keep your forage really simple, feed from the ground so you get better alignment in the jaw rather than hay nets if you can. And time at grass, which is I think is probably the most vital area. If we can prove our horses eating welfare, then I think that natural as possible, so out in the field, if we can, and it's viable as much as possible, is a great sort of move in the right way.
Obviously, that has so many other benefits, not just to teeth. So yeah. Is there anything else that you would add to that, Stuart, before we move on to our
No, I couldn't agree more, really. I think, as James said, sharp points and relatively minor overgrowths are what I'm seeing absolutely every day. Yeah, it does come down. There probably isn't anything we can do to completely avoid it, but minimize it is feeding as much rough forage as we can, and just keep it as natural as possible. Yeah, the ones that always have the worst problems are the ones that are fed, multiple complicated things and lots of soft. We need them to be grinding. We need them to be using their whole jaw and spending a lot of their time, just the chewing.
Thank you. So we're now going to jump into our audience Q&A, and just to kind of let you guys know that we have a nice sort of international range of people. So we've got for UK focus, we've got Northamptonshire, Northumberland, Cambridge, Warwick, and then we're going to jump over to the US where we've got Wisconsin and Ohio. We've got somebody from Canada and somebody from Greece watching, and I'm sure there's plenty more. So yeah, we've got a nice say international audience out there. So let's go. I'd say if you just repeat, if anybody on Zoom, if you upvote the questions you most want to hear asked, we're going to try and get through as many as possible in the next 40 minutes. So we have a question here from Katie. So she is saying, shortly after buying her 4-year-old, she discovered that he had an abscess in one of his molars. The infection was draining out of a wound underneath his jaw that was missed in the vetting. The tooth was removed, but unfortunately the infection had spread to the neighbouring molar, resulting in that tooth having to be removed as well. It was a complete nightmare, as we can sympathise, and it took him quite months to recover. She's now got a fear that this could happen to another tooth, and is there anything that can be done to prevent this from happening?
The short answer is, unfortunately, there's nothing that she can do at this stage really to prevent it from happening. It's always a little bit difficult to comment on particular cases without having all the information. But I'm hoping that this horse is now a little bit older, and she's hopefully beyond the sort of real risk factor for this happening. The most common time for horses developing tooth root abscesses is usually when they're younger, when that root actually before the roots are properly developed, so when the top of the tooth is open and susceptible to infections coming in, usually we think from the bloodstream. And so it is really, really bad luck that it ended up affecting 2 teeth. That doesn't commonly happen, but it may be that it's happened. It may be that it was all part and parcel of the same thing. But hopefully we're sort of past that risk factor for those sort of juvenile tooth abscesses now. I suspect if she was going to have another one, these infections don't usually come in from the mouth. So unless you've got a fracture or some sort of abnormality. Unfortunately, some horses, just like people, do appear to have weak teeth, and they do seem to be more susceptible to having some of these problems. And our current knowledge would suggest that that's just luck and potentially to do with genetics, but I don't think we have any more information than that at the moment. So good dentistry, keep a close eye on them, catch things early is probably the best advice we could give to Katie.
Okay, Stuart, thank you. And James, this one's actually is quite similar. So it's like from Rachel that my horse has bad teeth and has had several fillings. Is this just bad luck? Is it genetic, or is there another reason? Her teeth are checked every 6 months to make sure all is okay. She is 21 this year, and then she adds that when she has toothache, she head presses, drops her head, and twitches as though wincing from the pain.
Doesn't sound very good, does it?
No.
21 years old. The horse is getting slightly older, so there's the chance of dental sort of caries to lesions and decay is higher. Teeth are starting to get to the expiring very slightly, maybe at 20. But she's having fillings done and regular dentistry done, so that's good. They're keeping an eye on that. Can't you do anything about it? Usually I find these cases, like Stuart just said, there is probably a genetic weakness somewhere in there that's caused these more than just average problems. What can she do about it? She can stay away from sticky compound foods and try and feed, like we said earlier, a bit more roughage, sort of hard wearing feed. Try and think about, we see a lot of those sort of molasses licks. Try and make sure there's no molasses licks around, because that's sugar that sits on the teeth all the time, rather than you wouldn't get that kind of sugar levels in your average roughage. So think about your diet you're feeding your horse, and try and stay away from compound foods that are going to get in little small cavities that then start this decay process going. But by the sounds of it, she's on a really good lines in the sense of keeping those carious lesions to minimum by treating them. And she sounds like she's in good hands with her vet and getting these problems ironed out. So yeah, just think about feeding processes. But 21, I presume, I don't know what Stuart thinks, but 21, you're starting to move into those areas where you're going to get more of these problems anyway.
Yeah, absolutely. I guess the thing that stands out for me of that is we're assuming that we're talking about infundibular caries, fillings. That's what most of us would refer to them as. It would be unusual for those to cause pain, and so if you're getting head pressing and those sorts of symptoms that appear to be associated with dental pain, probably ought to be looking for something else, because there may well be something else going on that isn't just caries and fillings. So that would be the only thing that I'd add on.
Sort of speaking back to our vet to see if they can try and find another cause for this sort of head pressing and pain. And obviously you mentioned diet as well, but we have to be quite mindful about sort of polar mints and other treats as well. Like, are they going to be doing quite a bit of damage to our horse's teeth?
I mean, horses don't. When we talk about caries, it's predominantly a physical condition, because we're getting food either packed into these cavities that there probably is either a genetic, or there's definitely a failure in filling with them, less so than sort of sugar caries like humans get. But yeah, certainly anything that's sticky and is going to, or anything acidic in particular, will give us decay issues. So I wouldn't worry too much about the odd polo mint or the odd treat, or I guess I wouldn't disagree with James, particularly about the licks, except that we find them extremely useful for some behavioural cases, particularly horses that are needle phobic. So I wouldn't throw them away, but I certainly wouldn't be using them every day. And I think particularly if you've got a horse that you need to do behaviour modification with, if it's something that's of high value that they're not getting every day, then that's helpful as well. So keep them for a special occasion.
Okay, that makes perfect sense. So James, got one here for you. So it's from Jacqueline. So back in my riding school days, she says, in the UK we used to wrap the horses and ponies' teeth ourselves. Were we doing more harm than good?
They used to what? Sorry, do their own
They used
horse's
to
teeth?
rasp their own horses and ponies' teeth. Yeah.
Okay. It's an interesting one, because we talk a lot about unqualified dentistry and people, what I call lay people, doing dentistry without any particular education. And it's very easy to go around sort of saying that's a bad thing. We shouldn't be doing that. Should be done by somebody who knows what they're doing. But going back in the olden days, there wasn't those people around. There wasn't vets that did high level dentistry, and there wasn't EDTs that did high level routine dentistry. So could you argue that somebody in their day who hopefully would have just knocked some sharp points off and made the pony comfortable, is that a bad thing? Probably not. And we shouldn't really diss that, because at least they were getting some kind of dentistry along, you know, in the days gone by. So I'd like to say yes, but truthfully, probably not. It's not a bad thing.
Yeah, I can remember my first job, James, getting out the car, and I, you know, super keen on dentistry even at that stage, getting out the car, getting the gag out, and being told by a client, "Oh, your boss doesn't need one of those." And that's, you know, 20 years ago. That's sort of the level that we were having to deal with. So
I come from a riding school background, and my parents had a riding school, and the farrier used to do our ponies' teeth, and I don't ever remember it happening. My mum assures me the farrier went did the feet and then would come and just. I'm hoping he didn't use the same rasp, but I've got a feeling he probably stuck the
I
same
got
rasp
it,
up there. But
yeah.
it has moved on, honestly, since then.
I hope that puts your mind at ease, Jacqueline, a little bit.
Yeah.
Yeah. Stuart, so the message from Tomomi saying, like, is chopped hay better for a senior horse with bad teeth, even if she's not quitting, compared to regular hay? And if the horse is quitting, sorry, is it can cause impaction or risk factor to, or is it a risk factor to developing impaction?
So I guess the question we don't know the answer to is what are we referring to with bad teeth? So some older horses will, if you think back to that picture that I showed of the very long tooth, eventually that will get to the end, and that tooth will either continue to erupt, become loose and fall out, or be taken out, or it won't continue to erupt and will simply be worn down to a little smooth, flat surface and have no useful grinding surface left anymore. And those horses are, even if they are able to eat hay and they're not quitting it. Quitting is usually associated with pain. So a lot of these horses will be able to eat hay. What they're probably not able to do is digest it, because if they're not able to break it down into sort of 4 to 5 millimeter lengths, the cecum is unlikely to be able to digest it properly. And so with those, I would definitely be advising some sort of complete diet replacement in the form of an already milled fiber cube or nut or something along those lines. And if it's a complete meal replacement, it's a very large amount. That we're talking, this is not just a small feed, but that's very finely chopped. That's chopped into these sort of 4 or 5 millimeter lengths. If they are quitting, if they are having, I'm not sure it's necessarily quitting. If a horse is having difficulty eating, then that is definitely a risk factor for impaction colic. And trying to deal with that is trying to deal with the primary problem is really, really important. Do I think you should still be offering them hay, even if they're potentially not grinding it down enough? As long as they're eating it comfortably, then I would say most horses will be able to cope with it. It won't necessarily cause them an impaction, but you may need to be supplementing it so that they're getting enough digestible fiber.
And if they're not digesting it enough, is it going to be quite obvious, like looking at their feces and everything? Is it going to?
It can be, or simply we see it sometimes with horses that they're just starting to lose condition, because they're just not getting enough. There's enough going in, but it's they're not able to utilize it.
It's quite an interesting one, that, because often when you suggest to an owner that perhaps they should look to change their horse's diet, and you give them some suggestions of, you know, like your fast fibers or your veteran vitality sort of mushes, when next time you see them, they always go, "God, he really enjoys it. And you think, yeah, it's because the poor thing's starving and actually he's not getting the quantity he needs. So that discussion then moves very quickly into hay replacers and stuff that Stuart's just talked about. And then suddenly you go back 6 months' time and the pony's blossoming and looks fantastic. The fact is they just can't get the volume of food they need. And the dangerous factor, feeding hay that's not being digested well, is, again, there's a risk of colic. And on the other side of that is the risk of actually you're feeding quantity of something that's not getting used properly, and it's almost a waste of money, if you see what I'm saying, rather than actually something that's getting used properly. Yeah.
And you can almost see it's a bit of a spiral, isn't it? If they're obviously having to, if they're having to go into a hay replacer or much softer food, they're going to need their teeth are more likely to be getting sharper that bit quicker. Is that going to be right? So they're going to be needing more regular dental
Well,
care.
in my case, usually if they're at the stage where they're needing hay replacers or softer foods, to usually find their teeth are either
All right.
stabilized and are not changing, or falling out, or whatever might
Okay.
be happening at that stage in their veteran career. So but on the flip side of that, we do see horses at 30 plus still with a beautiful set of teeth, and I see 15-year-olds where it's a right mess and they're all over the place. So there is a little bit of luck involved with your genetics of your horse's teeth, as is with humans as well.
As James said, those are often the ones that they don't necessarily need rasping, but they certainly need checking. So that you'd want to keep them on a 6-monthly exam. Hopefully, they don't need any treatment doing. But as somebody once pointed out to a group of vets who are interested in dentistry, actually, if you go to the dentist and you for your 6-month check and you sit down and he says that's all absolutely fine, you don't need any work done, you think, well, that's brilliant, and walk away. And so if we're checking horses and they don't need work done, that doesn't mean we need to check them any less frequently. It just means that things are okay at this point.
Thank you. Here's one for you, James. It's from Facebook. My mare had a sinus infection which turned out to be caused by a rotten tooth. How common is this?
How common?
Yeah.
I think very common. I think if the tooth's not found early enough, and that can sometimes be a simple mistake or overlooked. Sometimes the pulp chamber, open pulp, is very small and is easily missed. But it's quite common if you're in any of those 4 back cheek teeth of the upper arcade, they sit in the sinus cavity, so the infection has to go somewhere and usually goes into the sinus and then causes secondary problems. So again, finding these problems early is the benefit of making the problem as small as possible rather than making it larger and worse. But for it's not always easy to see these cases, and it's very easy to miss them. So a good thorough inspection, and if there's any doubt, referring, usually oral scope is the way forward. You can see a lot closer in much more detail.
Well, sometimes you won't see any oral signs at all.
This is true.
The infection can start in the roots and never, or take a very, very long time to get down to the surface of the tooth. So although I agree, James, I think a lot of the time, if we're looking very carefully, we will find open pulps in these horses. Sometimes they're just they're not there. It's always lovely if they are, because it really confirms that you're on the right track and you're looking at the correct tooth. But sometimes X-ray is all we've got, or CT in particular, really complicated cases.
We have another one here from Facebook for you, Stuart. What are the ongoing what are some of the ongoing issues a horse with a parrot mouth may have, and can anything be done to rectify this?
In terms of ongoing issues, by the time they're an adult, we've really missed any chance to truly correct it. So we're then dealing with keeping things under control, and the biggest problem that it causes is overgrowth of those teeth that are not coming into contact, whether those are just the incisors, or in a lot of cases, if the whole of the upper and the lower jaw are misaligned, will develop very large or potential large hooks on the upper front cheek teeth and the lower backs. And with most horses with parrot mounts, as long as the balance is taken care of and that's done regularly, it doesn't cause them any problems going forward. But obviously it can cause, if those overgrowths become very large, it can cause them all sorts of pain issues, both eating but particularly performance. There are some techniques with if you can get to these horses as foals, and particularly if the parrot mouth, if it's just the front teeth and doesn't severely affect the cheek teeth, there are some specialist techniques to effectively wire and encourage those teeth to grow to erupt in a slightly different way. But you've really got to be getting at those as very young foals.
Thank you. And there's a question here that I'm actually going to ask both of you to answer. So it's from Gail, and it says, could you comment on how you assess the pain level in horses with dental jaw pain? Horses are so stoic that it's disturbing that as horse owners we may be missing the signs of pain, especially for EOTH and TMJ issues. So yeah, Stuart, you can start, and James, I'd like to hear your response as well. That'd be great.
So the EOTRH, so when we're looking at those front teeth, have a look. Sorry, I should have got a link together, but have a look on the internet for videos of the carrot test. That's quite a useful place to start. Can your horse bite down on a carrot? If you hold it firmly and don't give it up, will they actually bite through it so that they can take that? Most horses should be capable of doing that. As I said earlier, some of them just don't like to, but if they've always been able to do it before, then it's something you can keep an eye on. We use what I generally find with a lot of horse owners is actually they're extremely good at picking up on subtle cues that their horse is not comfortable. It may not be clear that that problem is to do with the mouth, but often we'll find dental issues in horses that we've gone to see because they're just not right. And I found fractured teeth in those cases that have then that horse has then gone back to being bright and happy and as it was before. So sometimes just trust your instinct. If you're looking at yours and you know what, this is not, there's something that just doesn't quite fit. Quitting is obviously a big sign of dental pain, but it's quite an obvious one, and as we said before, not every horse will do it. James, do you want to touch on sort of lateral excursion of the jaw? Because that's something I find that can be quite a good cue.
Yeah, I think TMJ pain is an interesting one. The average EDT, certainly a BAEDT trained average EDT, will do a head examination and often palpate around those TMJs and see if there's any reaction under pressure. And often you get a horse that will wince away from you. And that's always a small indication there might be something a little bit painful going on there. Then we do something called lateral excursion. Not all EDTs believe in the process, but it will give you a very basic idea if your horse laterally can move its jaw evenly one way or the other. And then what you're looking for is to centralize the incisors and then laterally excursion that jaw, and it should be the same both sides without any major reaction. It's quite a hard thing to do if the horse isn't sedated, because you get resistance from muscle mass, but certainly when a horse is sedated, you can certainly get an idea of how well that moves, but you need to see unsedated to see reaction of movement, whether the horse is functioning evenly on both sides. So lots of people say you can't check it truly without sedation, but also in this case, we're looking for a reaction of pain. So unsedated is a better way of checking that. The carrot test is really interesting. We talk about the carrot test quite a lot. And what people tend to do with the carrot test, when you say do a carrot test on it, is they hold the carrot quite firm, and the horse will often sort of bend its neck to snap it with the incisors rather than actually following it and it really to get it to bite that carrot off truly. It's not the best test in the world, but it's a test. But yeah, lateral excursion we've just talked about. Sorry, I'm digressing again. Sorry, Stuart.
No, sorry. I think I would agree. I'm not a complete believer in sort of some people are so totally focused on lateral excursion in terms of taking measurements and those. I'm not sure it's certainly in my hands, I'm not sure it's as accurate as that. But I think if you hold the lower jaw, make sure those front teeth are together, and slide the lower jaw to one side and another. If you can go nicely to one side and it will not move at all to the other side, even if that is to do with the muscles tensing up, it's probably doing that for a reason, and there's often a pain source there. 9 times out of 10, that pain source will be coming from inside the mouth, but occasionally it will be coming from the TMJ. And yeah, any suspicions at all, get it checked.
Checked, yeah. We've probably got just about 10 minutes left on Q&A. So I'm going to ask for some slightly shorter answers now to see if we can get through
Sorry.
this list. No, it's been very interesting. It's not definitely not a criticism. I'm just going to see if we can get all these questions answered in the next 10 minutes. It might not happen, but we'll do our best. Okay, so are sinus infections in horses always caused by dental problems?
No, about 50%. If you look at the research. So
Perfect.
you can get primary sinusitis, which is usually caused by infections, virus or bacteria.
Okay, James, so my old horse is near 30 years and has oh sorry, it just jumped up, and had quite a few teeth taken out, and the rest are also quite worn out. He cannot chew hay, but is doing really well on a mixture of soaked hay pellets, alfalfa, and beet pulp with vitamins and minerals. Can you please share some more advice about feeding old horses?
I'm not a feeding specialist, but Veteran Vitality, I'm obviously not assigned to Dobson Horrell, but hey, Veteran Vitality seems to be a really good one for, it's designed exactly for that sort of feed. But she sounds like she's on a really good track there of good high fiber, maybe not the beet pulp, but certainly the high fiber nuts soaked or grass nuts soaked is a real cheap way of doing it. But Veteran Vitality, there's lots of those sort of products out there now. So it sounds like this lady's on the right path already.
And obviously, as long as our horse is sort of looking in good condition on it, it's probably getting everything it needs. Yeah.
100%, yeah.
Perfect. Thank you, Stuart. Roughly what age might we expect to see arthritis in the TMJ?
So visible arthritis, often older horses, in terms of really severe, particularly if it's causing issues eating. But I think TMJ pain can, again, it's a bit like arthritis in any other joint. We think of it as an older horse condition, and yet it's probably the primary reason that we see horses for lameness is arthritis. So usually, in their teens, I've got quite a few on the books that we medicate their TMJ relatively regularly with subtle changes in the joint that are even early to mid-teens. So almost any age, but it tends to be teenage onwards.
Thank you. And James, like how long after wolf teeth removal can a horse be ridden again?
There's varying topic of this, but my sort of guideline always between 7 to 10 days. Sometimes the race horses tend to be bridled up and going to the gallops before they should, but hey, but yeah, 7 to 10 days is a good time. And this is again come back to what we were saying earlier. The earlier you find them, you take them out 2.5 years old, the horse isn't going to be seeing a bit for 6 months, if not a year, and it's perfect time to take them out, so get them checked young.
Thank you. Another one from Facebook. So my horse is seen by an EDT yearly, and it was seen quite recently, but it's still quitting. What steps can I take? Stuart, I'll ask you.
Might be worth having it examined under sedation if it's not already. And if you're concerned, obviously if you're concerned, potentially worth looking for a second opinion. If you're if you're happy with your EDT and you trust their opinion, then potentially get both them and your vet involved and say, actually, can we have a look under sedation? Do you have access to a dental camera or an oroscope, and can we have a bit more of an investigation? Quitting isn't normal. You will see it sometimes in these older horses with worn out teeth, but it's other than those, it's almost always a source of pain, a sign of pain.
Okay, no, that's a nice clear message there. And James, like, do vets or EDTs offer any package deals to help keep the cost of dental care down? And then someone else has added just that that their vet does offer a monthly plan that includes a yearly dental check, vaccination, and it might be worth asking your vet. Is that something that either of you have come across?
I've definitely seen vets practices have a package put together, vaccination, routine dentistry, so on and so forth, and people pay into that package either monthly and get it when they need it, or they'll pay an annual fee, and a lot of these things we rolled into package. The average EDT won't probably do any kind of package, because the package they're doing is the teeth. They're not trying to lodge it onto anything else. So no, from an EDT probably perspective, but certainly for vets, there's quite a few practices trying to jump on that bandwagon of being it all done in one go. I don't really know if it's a good or bad thing, or whether it's financially benefited to the vets. I don't know, but I don't know how it works.
I mean, those things are always about trying to maintain client engagement, really, and trying to keep everything sort of under the one roof. I think it's probably more important that you're using somebody who you trust, either a BADT qualified EDT or a vet who has a specific dental interest. The only package that we offer is that because we tend to sedate most horses for dentistry as our own personal choice, we include the sedation in the charge. Other than that, it's just charged as normal.
And then so James, although maybe they don't offer EDTs, don't generally offer packages, do you tend to offer, if you went to a livery yard, is there sort of a multi-horse discount that do you where the EDTs offer, or is it really just price per horse?
It's price per horse. Every horse is worth the same,
Yeah.
so same for me.
Okay, another one from Facebook. How can we work with vets EDTs to help young horses and nervous horses get used to the equipment needed for dentistry while causing minimal stress? Are there any top tips that you have?
From my perspective, a lot of the big yards I go to will engage a vet on our first sort of baby visit. We might give them a mild sedation to take this, because often these horses are under stress, just the fact of being out of their natural environment. They're usually youngsters that have been living out in a big herd somewhere. So we bring them in and they might get a mild sedation first, maybe even second time. So we can introduce things nice and slowly rather than just all a bit gung-ho and wild. So for me, if you can introduce things earlier, the better. If there is stress involved, perhaps take the stress out with a small sedation, whether that's neural paste or whether it's help from the vet to ease that process through. And usually you find within 2 or 3 times that the horse is quite relaxed and the process is happening. But alongside that, the horse gets an education as well. So it helps move the process forward.
It might be worth looking at things like clicker training if you've got young or nervous horses for everything, really, just in terms of getting them used to having veins raised for the vet, having their head felt, having their gums looked at, all of those kind of things. Anything you can do that just encourages the horse to sort of stand still and just feel more comfortable. We use clicker training a lot for horses that are nervous about needles. And it's extremely effective. So there's loads of resources out there, including, I think, including on our YouTube channel, but I might have to double check that.
And I think we've done it, guys, because we're on our last question. Yeah, you can both take. Oh no, someone else has just popped another one in. Anyway, how beneficial is it to browse willow branches and wearing down sharp points?
Not particularly, as far as we know. I mean, these things are used quite a lot in rabbits and some of the sort of rodents, and they're quite useful from that point of view. In horses, not particularly. They do aid, I think, having the ability to browse in hedges and things, I think helps with, is good from a quality of life point of view. Just be a bit cautious about willow in particular. It does have aspirin in it, so it is actually an active, although natural, it is actually an active drug. So I wouldn't put in a lot of willow branches, but we don't think they are particularly helpful in terms of teeth. But yeah, it can be quite a nice thing for them to be able to have a good look around.
Perfect. And then James, this final one is from Natalie for you. So she's sitting her BAEDT exam next week. Any tips or words of advice for her?
You'll be fine. You'll smash it. You've had a great education within the process and you'll be perfectly fine. And she's only sitting her theory next week. She's still got a practical to go yet, so we'll be fine.
Not out the woods yet. And James, actually, I should have mentioned before that this is actually the second webinar you've done for us, because you helped on one about allied professionals. So if anyone does want a bit more information about this the EDT, the BAEDT, and the differences and the importance behind that, as well as other allied professionals, then I would suggest you go back. I think that was a 2022 one, but we'll try and get a link up at some point, and that kind of explores the acronyms in a little bit more detail. As I say, we're coming up to the end, so I'm just going to ask, first of all, from Stuart, if you would be able to provide a really short sort of take-home message for our viewers today.
I suspect our take-home message is probably going to be the same. Regular checks, every year to 6 months, particularly younger, older horses that are in work, and make sure that it's somebody who you can really trust and rely on their advice.
Thank you
Yeah,
very much.
I definitely mirror what Stuart's just said. Check your practitioner. Make sure you know what their qualification means and where it's coming from and where their education's coming from. And good regular routine work will lead to healthier teeth long term.
Yeah, and I think that's come loud and clear throughout the presentation. So thank you both very much. That's been really fascinating. We've got lots of great comments coming through as well. And I want to just take this opportunity to quickly remind people to email education@World Horse Welfare with any suggestions for future webinars. And to thank not only our speakers today, but also to everyone who attended on Zoom and watching us on Facebook, and anyone who's maybe going to be watching us in the future as well. We really look forward to seeing you on a slightly, our Welfare Wednesday is moving in 2 weeks' time to actually Thursday, the 15th of February, where we will be joined by equine science researchers Sebastian McBride and Linda Greening to delve into the world of sleep deprivation in horses and how it can actually affect our horses. So please sign up to the link which is in the chat as well. So once again, thank you very much for attending, and I'm sure we'll ask you back to do another one. You both done a great job. So thank you very much.
Thank you very much for inviting me.